Hello, Michael. Hello, Sam.
Hello, Rich.
How are we today? Good. Michael, you're on mute. I mean, I
Um,
can't believe we've started our podcast with a classic you're on mute. But
Uh,
Michael's protecting his data.
that's it. Yeah, exactly. Yeah, but that's a way to protect your data. Put yourself on mute. You know,
yes.
we actually had we had our annual team trip last week, and we had awards given out to the team, and I won one award. It was the You're on Mute award, which means that I'm most likely to be on mute on calls. So yeah, I understand, Michael. Anyway, we're using a new platform today. Anyway, look, thanks so much for joining. We are officially live, so I think we're gonna jump straight in from here. For those that have joined the call today live, thank you for joining. I know we have loads of people in the US and other places in the world that can't make this time work, so they'll be watching the recording afterwards. So this is recorded and we're going to be sending it out. So looking forward to that. Anyway, today we're here to talk about data security in the world of healthcare. This is a big topic, so we're going to see where we get to with Michael and Sam. We've got two fantastic guests. So we got Sam Shah from Numan. We've got Michael Ivey from Modern Health. You guys are going to give some intros in a second. And on that, what we're going to do today is after we've done some intros to sort of tell the guests who we are, where we're coming from, we're going to talk about data security in the world of SaaS. So we're going to talk about what is data security, what is health data, what is SaaS applications, why are they important, and then we're going to see where we get onto from there. So on that, let's get started. We'll start with some intros and I'll kick us off. So I'm Rich Vibert. I'm co-founder and CEO of Metomic. Metomic helps companies protect sensitive data in SaaS applications, sensitive data like personal data, like healthcare data, like financial data, SaaS applications like Slack, Google Drive, Microsoft Teams, Notion, and protection meaning giving visibility over where data is in SaaS applications, as well as automating the remediation of particular risks that might crop up as employees just go about doing their jobs. Anyway, that's enough from me. The guests here today, we've got Michael and Sam. Sam, you want to give a quick intro to yourself?
Hello. Thanks, Rich, for inviting me to this session. Great to join you in the Metomic team and pleasure to meet Michael. So I'm Sam Shah. I'm the Chief Medical Strategy Officer at men's health company Numan. Numan is an online healthcare provider for men in the UK. And by background, I'm a clinician. I'm also a lawyer, and I'm the data protection officer for Numan as well. And really, this is a super fascinating topic at the moment because data is flying around all over the place. And how do we keep people safe? How do we keep their personal lives safe? And how do we make sure the healthcare they get is basically not predicated on the misuse of their data, but really the data that they have is maintained securely, safely, so they get the best care possible.
Absolutely. All right. Thanks, Sam. Thanks for joining. And Michael, a bit about yourself.
Yes. So my name is Michael Ivey. I'm a staff security engineer at Modern Health. We are a health tech startup that provides mental health services to businesses for their employees. So making that a bit easier for folks, which is super important. And definitely looking forward to discussing this topic. Data security, especially in the healthcare environment, is really important. And, want to chime in and have a discussion about this so that we can all just kind of learn together.
All right. Thanks for the intros. We got such a great different set of experiences here. We got Michael's obviously come from a security background, and then Sam, you got the clinician and medical in your title even. So interested to see where we go in terms of talking about data security. And just quickly, so Michael, you're dialing in from the US today, is that right?
That's correct. Yes.
And Sam, you're in London.
I'm in very not sunny and grey London.
That's just by default, Sam. You didn't have to mention that, really, doesn't it? That's what people assume when they hear London.
I reckon it's because we're talking about data and security today.
Maybe. Well, maybe by the end of the call it'll be bright. Let's see if the sun does come out. All right. So, okay, going to start with the simplest of questions. We talked about sensitive data a lot. Even 2 minutes in, we've been mentioning sensitive data. What is sensitive data to both of you guys? Sam, what is sensitive data for Numan?
Well, in the most practical of senses, it's those things that is really sensitive to people. In our case, as a healthcare provider, it's health data. So someone's data about their health status, about those things that are more than what you just find in the public domain. So not the sorts of thing that you'd find publicly if you search for somebody like the electoral register. They're not just their name or their even part of their address, but more than that. What is their health status? What diseases do they have? What conditions do they have? What have they experienced? What's their vaccine status? All of that to us is sensitive. Of course, enshrined in law is being sensitive. So yeah.
And enshrined in law on that, what are you trying to keep? What are you trying to keep data safe from? What are sort of the reasons that you care so much about it?
Well, I'm guessing that all three of us probably have similar actors that we're worried about, but different parts of the world have different problems. The US has problems in the UK are very different when it comes to health data and why we're keeping it safe. So I think of this in two planes. There's those people that might be looking for data in order to hold organizations to ransom. Now that happens less so in the UK compared to the US, simply because the value, the commodity of data is a little bit different between the two. And so that happens to a lesser extent, I would say, in the UK compared to the US. But there's also the other side of it, protecting the individual and making sure that the data isn't used in a way in which they didn't intend, or even the healthcare provider didn't intend. So, for example, we don't want data getting out there that people use for illicit marketing purposes that the individual never really subscribed to and hadn't intended for their data to get to. So they're kind of the two different planes that we think of. Of course, there's the other side of it, the selfish side, which is making sure that we protect that data so regulators don't stamp down on healthcare organizations, which is be very detrimental because those fines are pretty big at the moment. But I'm guessing Michael has perhaps a different or a related perspective.
Yeah, Michael, what's healthcare data to you, and what do you think about when it comes to protecting it? What are you trying to protect it against?
Oh yeah, so healthcare data, for us, we've got PHI, we've got PI, the data that comes out of medical devices, research data, which we work a lot with, financial data. There's billing, and so there's a lot of threats and risk to that data. From the PII side, you have threat actors that are looking to get that information for multiple reasons. Just being able to take someone's identity or use it to hold against them for whatever reason, to try to get them to do something. And then you have financial data as well, where, if you can get access to financial data, you can transfer money from their accounts, you can just do other malicious things. And so we want to make sure that we have the right security controls in place to protect that data. And that's required by HIPAA. Right?
It's really, really interesting that Michael mentioned the financial data there, because actually in the UK, it's not something we think of so often. Certainly private healthcare providers like ourselves at Numan, we think about this. But actually for the majority of the UK, because it's mainly a publicly funded health system, so a lot of people don't actually directly make payments for their healthcare. It's not something that we often easily or readily think about. We often forget about. It's a really important reminder that actually that's another dimension that we need to worry about, but for one that will become more prevalent as time goes on.
Yeah, and I mean, Sam, you also said that maybe Michael's got a different perspective on it, like the malicious versus non-malicious. There's obviously an aspect of when you're operating on healthcare data at scale across a big staff base, there's accidental, we're going to come onto this, right? There's just people doing their jobs versus people trying to hack and get access to this data. Michael, Sam was sort of wondering if it's different from you. Is the majority of your job trying to prevent those bad actors, or prevent the lot of non-malicious just employees trying to do their jobs? How do you think about those two things?
I think about both of them. And so the insider threat, whether it's malicious insiders or just accidents, as you mentioned, we got to help our people to be more secure and do things in the most secure ways. Sometimes they just don't know. And so we're protecting our internal folks as well as protecting against external threats.
Okay. This internal external is really fascinating, because internally, I tend to find, and certainly in the organization I'm in and in the NHS that I was in previously, so the NHS is the National Health Service in the UK, and there's lots of organizations in it. And what you tend to find lots of people are just trying to do their job. They're just trying to do the best job they can. But inadvertently, they do things like they'll create files on spreadsheets with lots and lots of rows of data, but not protected spreadsheets. They share those things over email. They contain, and so suddenly, by accident, they've released data about subjects, individuals, patients, often sometimes staff, totally by accident. And on the one side, it's non-malicious. But that file in the wrong hands suddenly could become, have some malicious intent attached to it somehow. So it's really interesting to see how internal and external kind of play together.
Yeah, and I think I mean even myself, right, is starting Metomic as a vendor that helps companies protect against these different types of threats. I don't come from a security background, right? So I come from a data science background where I was using data to do my job. And what frustrated me the most was, and no offense to the security team coming to me and saying, you can't do this thing. And I said, when did you tell me this? How did I meant to know this, right? I feel like a bad person now, but I didn't mean to do this. I'm just trying to get my job done quickly. And especially in the modern era when speed, productivity is so important, I think this internal non-malicious threat is growing, right? Just people doing their jobs. And it leads us on to SaaS, right? Like, I mean, Michael, you both of us, all of us use SaaS in different ways. I mean, Michael, tell us how Modern Health uses SaaS. I assume it's a big part of day-to-day operations over there.
It is. All of our applications are SaaS, from storage to the services that we run to provide our service. That's all running in the cloud. So it is used by everyone within the organization. There is no firewall networked that we're all behind.
Yeah. And we were even saying when we joined this call and you're on mute, we're technically using a SaaS platform now, right, to talk about these types of things. So everything is SaaS, more than I think a lot of people realize. Sam, SaaS house over there as well?
Yeah, I mean, look, Numan is a digital health provider. We started off out of one of those co-working type offices. Yeah. So you can imagine that everything we built is built around that model of using SaaS tools and products. There isn't any physical on-prem server anywhere that we have. We're not sitting in a private network as such. And I was wondering about this the other day. I was thinking, well, if we were in a closed network, these things are more easily managed because, of course, you've got people managing the network security. Suddenly, when you've got people working at home, working from coffee shops on public internet, all sorts of things, they might think their device is safe. But actually, when they're accessing all those applications over the cloud and basically, over what are public internet gateways, but suddenly, what are the chances and what are the risks of actually the data transfer being violated in some way? Mm-hmm. And they're probably pretty high. But it just did make me think that in this world of SaaS, do we need a different approach to data security and privacy that people didn't think about before?
Of course, right. The world of SaaS has completely changed the way we do work. And even Michael, you said, data storage is now happening in SaaS at scale as well. It's not just communication like Slack and Microsoft Teams. It's almost taken over a lot of the tech stack as a whole. What SaaS apps scare us? So for me, CEO of Metomic and independent of what Metomic does, Google Drive, right? These apps are becoming so collaborative. Every day I wake up and it feels like Google Drive's got an easier way for my team to share links publicly. Does this not, am I alone in this world, or does that scare you guys as well?
Definitely, yes. It's easy for anyone to just share a file, share a folder with themselves, with someone outside the organization. And this is where you really have to understand the controls that your tool has, where you can block that stuff, make it secure by default. Don't allow them to share outside. But if you're not locking it down, if you're not thinking ahead, it's easy to find yourself with a bunch of files shared out of your organization.
Sam, Google Drive user?
Yeah, I mean, look, whether it's across the organizations I work with, so there's stuff I do at Numan, and there's some traditional healthcare providers I still work with as well. And it's everything from Dropbox, OneDrive, Google Drive, and then some of the applications go with them. it's now so easy to share files in any direction with anyone, anywhere, which on the one side is great. It makes working together, collaboration so much easier. Efficiency and productivity in our workplaces improves. Gone are the days when we're walking around with what I remember being 5.25-inch floppy disks, and from one organization to the other, right? That's all disappeared. And so on the one side, it's great that we have this functionality. On the other side, I'm also seeing a lot of accidental sharing, where I'm trying to work out, who is this random person that has access to this file? Why did they have access to this file? I didn't even recognize this email domain. And so the collaboration tools are fantastic, but it does make us really have to work much harder around how do we prevent sharing that was unintended, but files created for the right reason.
Exactly. And have either of you ever been through this, like thinking, probably at the exec level, you're thinking we have to change which SaaS we use because of security and privacy?
I mean, I've definitely had that conversation. And if I think about some of the tools that existed in the organizations I worked with when I started to the ones we have now, it's very different. Our maturity around assessing those tools has changed. Now, having come from like big organizations where they have teams that spend like weeks and months analyzing any tools, in a small startup, we don't do that. But now we do have a process where our CTO, myself, head of legal, a couple of other people will examine these SaaS tools to work out what are their security credentials, what do they comply with, where in the world are they based, how and where is the data flowing, and we ask them how many attacks have they had, what's happened, how often did they pen test, and I'd certainly say 3 years ago wouldn't have had those conversations. Now it's a daily conversation before deciding on which tools. And for me, and this is not a plug for Metomic, by the way, so you can't use it as marketing. But I do obviously I do ask your team whether they have the ability to integrate with some tools that we're taking on, because it does make our lives easier having one way of assessing our environment, which for me saves me not only a lot of time but secures the data for my staff and for our patients.
Right. And like the thing is, even with because we obviously got due diligence on SaaS is at a whole new level when it comes to security, but even if they pass all those tests, right, they've done all the highest level of securities that they can do, it's the features which are scary. Like it doesn't matter how good Google Drive is in terms of securing your data, but it doesn't stop people turning these links public or sharing externally. And Michael, I assume you can't close down these features. You can't lock all files down in the likes of Google Drive. Like, they're necessary for doing your job, right, and moving forward.
Right. We have to find that right balance. Make it where folks can still get their job done, but we are also securing or doing things in the most secure way. And so, yeah, with these vendors, same thing. Where it goes through our vendor review process, where we definitely check to make sure they've got all the right security assessments happening, documentation. You have to think about, can this vendor keep up with our security requirements? Because if they negatively impact us, now that trickles down to our customers. And we are, held to a certain SLA and everything with our customers. So yeah, it's super important that the vendors are secure. And as they introduce new features, right now, AI is being added to everything. And so we have to stay on top of the notifications that come out, new feature, and some of these tools are just turning it on. And so if we don't want it on, we have to see if we can disable it. If we can't disable it, we're actually providing guidance to our folks on this is how to use it in a secure way, or don't use it.
Michael, are you finding shadow IT appears? Do you tend to find people trying to do their job? We might have decided we're going to lock something down, change something, close something, change the way it works. So instead of working a different way, some random tech appears on some device somewhere that's kind of off the grid. Does that happen to you? It happens to me.
Shadow IT is a thing, yes, and it's a scary thing for us in IT or in security. When we do see these applications just showing up, but it's great that we have tools that give us this visibility, and so we can for places where we can just block it, we block it, and we'll get a notification if someone tries to install an app or a plugin in their browser for some tool. But we also have our audits and our assessments that we do. And so when we detect these things, we educate our folks like, hey, it has to go through this process so that we can review it and make sure that it is secure. It meets our requirements. But yeah, shadow IT, it's a scary thing. And you want to do the best you can to be on top of that. Educating your users, so important.
How are you? I mean, this conversation wouldn't really be worthwhile without talking about ChatGPT. I assume Sam, particularly for I know Numan quite well. How is it feeding into your business, and then the privacy security aspect? This must have brought out a whole can of worms, so to speak.
You know, it's one of those things that every single day probably comes up in conversation, not just in Numan, but other healthcare providers that I speak to on a sort of daily basis. And it, on the one side, super exciting. It's going to change the way that people work, probably change the face of healthcare. On the other side, we've got so many things to work through. Certainly in Numan, like you just mentioned there, Michael, there was a tool that we use. We use it to communicate with our patients. And the provider of that tool did switch on a ChatGPT feature. And luckily, our head of customer experience picked it up pretty quickly. But had they not done, there'd have been data flowing through that. And we would be a little bit worried about the sort of data privacy concerns. And luckily, we switched it off in time. There are so many aspects to it. On the one side, we don't want to impede productivity and creativity in the workplace. On the other side, we've got not only the data that gets put into these large language models, and ChatGPT is one of many, and who that data belongs to. On the other side, that's what gets produced and used, which is a little bit out of the realms of security and privacy, but also the issue of intellectual property when it comes to using those things. So it's certainly something that I think is going to catch up with lots of organizations. And I'm waiting for the first few cases of infringement to come, whether it's data infringement or intellectual property infringement. They're going to happen. And certainly healthcare organizations have to think really carefully about what data is fed into these models and where is it derived from? Because if it comes from a patient that's receiving care and that is sensitive data, then we have to be super careful. And if we don't have permissions for that patient and we don't have safeguards and it's possible to re-identify the individual somehow, then that becomes worrying. So large language models on the one side could be absolutely amazing. They could change the face of healthcare. On the other side, they could suddenly expose people to privacy concerns that we all know exist, but we didn't know they were going to be exposed to.
And I think the conversation has progressed so much, right? Considering we're talking about how we make the use of it and how it's going to change things rather than how do we lock these things down. I think we're beyond that now, right? Like it is so difficult, firstly, to lock things down just technically because we're all on our own devices from homes and coffee shops and so on. But you don't want to lock these things down fully, do you? You don't want to. You want to innovate around them. You want to find ways that you can use them to make the best for your business. So locking stuff down is sort of out of the question. It seems to be leaning more towards, okay, this is what we need to do. This is where the world's changing. How do we, sort of fit security and safeguards of data into this new world?
I mean, I'd love it if there was some way that as people are using these tools, that they're being almost scanned in real time in my organization. So before someone presses the go button or whatever the button is that they press, it always flags. Are you aware that you're sharing something that could have an identifier in it? And if that existed, I think that'd be great. It would help encourage its use, but also prevent sharing that we didn't intend.
Exactly right. And that's the other thing. It's that's a non-malicious. You're trying to protect against more of the non-malicious there. It's an employee just trying to do their jobs or think they're not doing any harm, but not knowing the repercussions of this, right? It's Michael, you mentioned before, employee awareness is a new thing now. And I think that's adapting too. Like, I don't find personally Word document policies being signed the easiest way to tell employees what they can and can't do. Because all I know, a new SaaS app gets used tomorrow and then they're not going to read the document again. Employee awareness, Michael, there's a new dimension to that as well now, isn't there?
There is. I mean, it keeps evolving. And that is one of the most powerful things that you can do is educate your folks on what to look out for, on how to just act in a secure way. our people are really good about notifying us about things or asking questions. And you want to build a culture where they ask questions and they don't just do things where they're afraid to bring things to security. So yes, education is so important, and making your people feel like they can come to you and talk to you about things.
Give us some tips. How are you fostering a culture of these protecting sensitive data?
Well, it's coming from the top. Our leadership team is, behind us, supporting us, the security team. And so we are, doing a lot of things to reach out to other teams within the organization, to get them involved, to educate them. And our people are really good about it. Like, we have a lot of people that are really interested in security, from engineers to CS folks. So, we have meetings and conversations, just discussions about it, fun training material. So it's just really good the way that we're able to get everyone involved and help educate them on this stuff.
If you got non-security folks saying this is fun and you're doing something right. So yeah, that's a big win when you got people engaged on this sort of thing. That's great. Sam, how do you think about it? I joined Numan. I'm working there. What sort of things am I going to be exposed to and talk about?
It's an interesting topic area for us every day, because we have such a complex business now that spans about 3 different countries. Well, really 2 parts of the UK and another part and a part of Europe too. And so how we onboard people and how we talk to them about security and privacy has also changed. It used to be a little bit broadcast, where they come in on day one, they have to go and do all the compliance modules online. And we all sort of know what happens. It's click, 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 click through to the other end, and they get the certificate, and that's the end of it. But the reality is, it's about how they work day to day and that culture. So I've tried to change it a bit, and we've sort of tried to do these simulation exercises. So that certainly meant that people are more engaged in understanding it and trying to make it everyone's problem. So not just me as the DPO and come and ask me a question, but how do we get everyone else involved in this? One of my colleagues has a great idea around sort of how to do this, and giving people these almost real scenarios, but maybe they didn't realize that they were almost real, and how they responded to those things. What did they do? And then learning from that and learning in teams. So it's by no means perfect, but trying to get people to see the reality of a situation and what the impact is on a patient, on a citizen, on an employee, on a fellow employee, and working through almost a live example has probably changed the culture, where people now start remembering, oh, right, hold on, I did that in that scenario. I need to go and ask about this now, or I need to pause. But had they not, then I think it would have been quite different. The other thing, and you're probably both familiar with this, but I also find that the alerts that we get from the integration on Metomic on things like Slack and elsewhere do help, because they change behavior. People realize in real time, oh, I'm about to do something. Let me pause, think about it. It might mean that something happens and that action gets deleted now. And from that, we're finding that people are learning. They're realizing like what is permissible, what's not, what needs a bit of help. And so making things really actionable, I think, is the key here. I think I've gone to the days of signing a policy on a Word document or clicking through a presentation.
Do you feel like if you're enabling employees to be notified of certain behaviors they're taking which might be risky, does that scare you in any way, that you might be frustrating them, or when it comes to your fellow C-suite and so on, that let's say they're actually just trying to do something which is legitimate and not risky? Do you ever think about getting in their way, and does that sort of like scare you a little bit?
It does, and it did. And so the approach we took was, first of all, not to send everyone those notifications, but myself and the IT lead would get those things and work through them and decide, okay, is this in, is this not, do we do something? Then the next phase was to allow some of the rules to be automated, and then to the point where we started changing things. And it took some time to learn the patterns, see what was actually happening, use the data. And it was just taking an approach that meant that it wasn't overnight, it wasn't people being done to. there were lots and lots of points at which information was being shared around what we're picking up and seeing. So by the time it happened, most behavior changed. And now it's very much undertaken in a way that protects the organization, protects the individuals. Yeah. And so it has taken us time. I'd say we've probably taken about a year to kind of implement this new way of working, but it's been worth it because it hasn't stopped productivity in the organization. But at the same time, it's meant that we've tried to keep a secure environment.
And for the listeners, this is real-time notifications delivered via favorite communication app like Slack, for instance, to say, hey, you just did this thing in Slack or another application which may be risky. And then are you leaving the employees themselves to try and action that? Or is it like a warning for them?
Yeah, so a bit of both. We will have some where the employees themselves might take action, but I guess most of those our IT lead will have a look over them, and then sometimes they'll get referred to me if they need to. So it's a bit of a blend, and we find that works quite well because then it's not too much that's distracting all of the individuals, but at the same time there is someone keeping an eye on it just to make sure that we're operating the right way. And this has been a game changer for us because prior to this, we didn't have any real-time way of knowing what's happening. It's always after the event when the problem has happened. And so, and using something, in our case, like Slack, is part of our business model. So having something that works in a way that people are used to, it is also great.
It's quite amazing, even, notifying employees, them seeing these notifications, whether they action them themselves or not. We see this in Metomic, right? Like how much the level of sensitive data sharing goes down afterwards just from it sort of being embedded in them. So companies like Numan are really embedding this. It does take a while to get up and running, but we've got a lot of customers across the US and the UK, and many in the UK have got employees that the UK tech startup scene is still relatively small. We've had employees that have interacted with a Metomic notification before, gone to another company, so maybe they were trained by someone like yourself, Sam, and then when they land at a new company, it's just the natural course of doing business, right? They're used to this sort of thing, of these real-time notifications. So it's a long game, but I think it will become, my opinion, I'm biased obviously, is it will become the norm to have employees notified in real time and taking actions themselves, right? Here's a link, here's all the files that you created last week, which may be risky. Are they risky or are they not? Michael, what do you think? This real-time nature, you've got the one part, which is building a culture across the company and the day one for the employee, but going forward real-time in the world of SaaS, do you see this world being different in the future?
Well, yeah, I think this is definitely really powerful. Being able to get that feedback immediately, that's the best way to change the thinking of a person and help them learn. And as far as it being, too much, as Sam mentioned, tweaking your alerting, making sure that only the most critical things or actionable things are getting sent to the employees is going to help them to not get tired or worn out on the amounts of alerts coming in. So I'm really excited about using a feature like that just to make it more of a continuous education for the employees. And we should be able to see that the amounts of alerts trend downward with that sort of training.
100%. Sam, what type of messaging do you give to employees? Is it the bad, don't do this? Is it you did it? How do you think about this? Because we see such a variety of different ways security teams interact with their security, privacy, compliance, interact with the rest of the team.
Yeah, I try to very much avoid this is really awful, you shouldn't have done it. I tend to sort of go for trying to find out what were you trying to do at the time, what function were we trying to perform, understand a bit more about what happened to get to that point, and what can be done to help them do the same thing but to do it safely, and trying to go through the implications of a particular type of sharing or a file, and try to learn from what's happened and do it differently. And my worry is that if we're too hard with our teams, we will almost scare them into doing nothing. Actually, we want them to remain productive, active. We want them to continue to do great things. And so I tend to try to take the approach of how we coach people to use use data in a safe way and create files, sharing mechanisms that are compliant, but it doesn't stop their jobs.
Okay. That's it. You got to get the friendly message. Again, we're talking about they're not trying to do something bad, right? So it's not about saying you did bad. And the education, it pays off. They do less of it, and we see a lot of this in the results, which is great. Ironically, we could use ChatGPT, right? We could see what ChatGPT. I actually was just, when you were speaking, I hope you don't mind, Sam, I said to ChatGPT, what message can I give to an employee if they accidentally share sensitive data? We might have to refine it because it's given me a dear employee's name. I hope this email finds you well. I'm waiting to address a recent incident regarding an inadvertent sharing of sensitive data. And then it's an essay. So ChatGPT, let's not plug it in straight away, but maybe we can refine it from there and get something that's more deliverable via Slack.
I wonder if your ChatGPT response has written it from a very sort of, UK kind of cultural basis, or whether it's written it more in a US style. I'd be interested to work that one out.
Yeah, what about in the US? I wonder I'll have to test it out and we can come back to it. Maybe we can do a whole session just on ways to notify, using ChatGPT to notify employees in the most friendly way. But it's interesting. I mean, fast forward 5 years, I suppose we've all got different views on this, but I was thinking the other day, you've got recurring messages, right? So let's say you do create, let's say, go back to my favorite example of Google Drive, you've got a job to do, you have to share a file externally to get that job done. So it triggers a notification to say you just shared a file via Google Drive. This is potentially, risky. And the employee says, okay, that's meant to happen. Remind me again. This is some of the, the new features that Metomic's releasing. What does the reminder look like? This is what I've been thinking about recently, right? It's like there's a file that's still public and so on. What do you want to do about it? And maybe the employee can interact with these notifications in real time, not go into Google Drive. I don't know, Michael, if you got the zoom out 5 years, how does employee awareness look, right? Going from the Word document policies that were day one, what does the 5-year future of employee awareness look like in your eyes?
Oh, I'm actually a big fan of like gamification, making it fun for the folks, because it's that'll really get them involved, engaged, and make it stick. So yes, moving away from the, hey, read our policies and check the box or do a quiz at the end, to hey, let's make a game out of this. And I could definitely see how something like ChatGPT could be used to make that kind of more dynamic and just fun for the folks that are doing it.
And what am I getting if I do well in the game? What am I getting?
So I'm not really good at this, but my boss, he's like very animated and, gets people laughing, but he will come up with some great prize. Maybe you just make the security team get off your back for the next 6 months or whatever. Not that we're on their back or anything, but he's quick with it. I'm not that quick.
Sam, thoughts? 5 years? What are these employee notifications looking like? Do you think about the gamification?
I love that, and I also think, given the direction we're going in, will there be images that are created from a large language model of something to do with sharing and the employee that gives them different types of image depending on what's happened? Will we see a space where Metomic notifications basically get auto-generated in real time, and those images are designed around what that person might like or do that might make them do something, right? Or change.
Yeah, you could learn the best way. Like these language models could learn the best way, because every employee might respond differently to the different types, or maybe at different times of day, or in different formats or different applications. So it's actually that's a very interesting way that we could look about gamifying it from that standpoint. For us, I mean, I'll share something that I'm super curious about. Have either of you heard of an app called Bonusly?
No.
So Bonusly, it's a great app. I'm not plugging them for any reason. I've never spoken to them, but we use it internally. The company basically puts a bit of budget towards it, and employees can recognize other employees, and it gives them Bonusly points, which do translate directly to cash. So I think it's like 10 Bonusly is $1. So the company every employee gets a certain number of these Bonuslys every month to give to other employees. And then we thought about integrating this with Metomic. So if you do action and alert, or share sensitive data in a fair way, whether it be only in the Slack channels they're allowed to share sensitive data in, or only in particular Google Drive, it would automate Bonusly recognitions from the company to them via Slack. That's been, Bonusly has been incredibly powerful for us in many ways across the business. So thinking about ways we can integrate that by showing good behaviors in terms of security and privacy. All right.
I do like the idea of that. I wonder though, could that result in a whole kind of like cascade of people creating actions that result in bonus points?
Trying to work it out, trying to gamify it themselves.
Gamify it, right?
Oh, 100%. And then so when ChatGPT would come back in and help us figure out how to prevent that happening. Maybe. On the topic of security and privacy, which we are here to talk about, I want to ask you both about two different things. So we talked about it in the intros. Michael, I'm going to ask if you can tell us a bit about HIPAA. And Sam, tell us a little bit about GDPR and some recent news in GDPR, because these are two very different regulations and standards, but they overlap in a lot of ways. So Michael, you're a healthcare organization in the US. How does HIPAA come into play in your world?
Right. Yeah. So HIPAA, there's the privacy rule, security rule, and then breach notification. And so, making sure that, we are being secure, we're complying with their security requirements, which they reference a lot of other security best practices. But, protecting against data being leaked, making sure that data is protected, and any sort of modification is protected against, file integrity. So, we use HIPAA to basically ensure that we are meeting those requirements as well as our security requirements. And there's a lot of overlap there. Making sure that our product meets that, and we, just keep going.
Gotta keep going. And the when it comes to SaaS, right? In some cases, you're processing sensitive data via another company, another SaaS application. How does HIPAA interact with that scenario? Where does that come in there?
Yeah, so we have to make sure the right agreements are in place, depending on like who's the owner of the data, what data is being shared, processed, stored. And so, HIPAA has clear guidance on like how to go about doing that, making sure like a BAA is in place for any business associate. And so, yeah, we're just making sure that we're following those guidelines so that we can do business with them. And just in case anything happens, we're covered, they're covered, everything's good.
Because as far as I'm aware, if you have an application, a SaaS vendor that you don't have a BAA in place with, and you do give them sensitive data and they lose the sensitive data, that's on you, right? That's not, you can't just say, well, it's not our fault. It's you were the one who sort of owned, and in GDPR land, you call a data controller. It's your responsibility to ensure that your SaaS environments are safe, right?
Yes, it is.
So similar overlap. Sam, tell us about GDPR and what's been happening in GDPR recently.
Yeah, well, GDPR, so those people who don't know, the general data protection regulations that cover or did cover the whole of Europe when the UK was part of Europe. Now we have two regimes that take place. We have UK GDPR and EU GDPR. Now both are pretty much identical still as at today, but it has changed a few things. So for anyone that does or doesn't know, it's all really about how we control and process data and the expectations of those people that control data and those that process data. And so organizations have to register with a supervising authority in their state. So in the UK, it's the Information Commissioner's Office. In the other EU states, it's whoever the local protectorate is in those particular states they have to register with. Now you'd think that Europe being Europe, and previously when the UK was part of it, there would be fairly high levels of consistency across Europe. Now, on the one side, GDPR is relatively consistent in that its interpretation is consistent in most states. But what then has emerged is that some states have taken a much stricter approach to enforcing GDPR and interpreting it compared to others. That's resulted in some interesting case law, and one case in particular. Now, one of the things that we've certainly seen is a divergence between the UK and the EU when it comes to standard contractual clauses. So the UK is considered alien now to the rest of Europe and everywhere else. And therefore, we have to think of pretty much everything as being an international data transfer. So anything that leaves the UK, well, it's leaving the UK internationally if it's going to a third country, because basically we are no longer in the EU. And of course, we are not in the US. So anything that moves from here has to
and Sam,
go.
This even includes like someone reading data on a screen, right? It's not even necessarily like sending a parcel of data to it. It includes people being in a third country, or like the US or the rest of Europe, and seeing that data.
Right. So any data that is effectively then being processed, because that's effectively what we're doing when we're reading that data, does fall within this.
Right.
Now, luckily, there are some places that are recognized by the UK and the EU as being safe places. And there are agreements in place that mean they're recognized in that way. And more recently, there's a bit of an issue thrown up between the EU and the US as to whether the EU-US data privacy framework, previously you might notice the Health Shield, has basically could continue. And the Schrems case was the big case that threw this up, because the EU court decided that the US authorities, that the way in which they were perhaps maybe some of the US public authorities, maybe some of the special services there, were using data that may have come from the EU in a way that people didn't have control over. So the most recent thing that's emerged is the EU-US data privacy framework that has taken into consideration the court findings. The US has issued an executive order, and that's then now meant that the US is deemed to be a place that you could send data to from the EU using the existing frameworks and processes that are in place to do that. And that's been great, because had that not happened, it'd been very difficult to share data between entities, especially if you're a big, large corporation spanning different jurisdictions. You need to move data around, but also there's massive economic benefits for us all working together. There might be businesses we want to work with which are in other countries, so we need to find ways of sharing that data that allows safe processing. Now, this doesn't take us away from all of us having the thing that Michael mentioned earlier, having data sharing agreements in place. Of course, we have to do those. We still have to do our impact assessments in the usual way. We still should do our due diligence of organizations, but it does at least mean there's recognition at the EU level that we can work with organizations in the US. The UK doesn't have an agreement in place yet, so the UK doesn't have an equivalent framework in place at the moment, but it seems likely that now the EU has done so, it seems highly likely the UK will follow. So that's a very short stop tour over GDPR in the UK and the EU.
I think in general, it's other than I understand there's still questions around, whether it's the right thing for citizens, but certainly just purely looking at it from a company perspective and the productivity stuff we've been talking about today, it alleviates a lot of years of work that would have had to go in, right? When we look at the SaaS supply chain, so to speak, and the fact that if you give your data to a SaaS app, you're probably giving it to 5 other apps that are integrated with that app at the same time. At some point, the data somehow ends up in a US data store of some, manifests in some way. So I think for a lot of people, it's going to save a lot of very difficult work that would have got in the way of the productivity and not allowed Europe, I don't think, the same level of innovation that it needs right now. So it's a interesting news. It's a big news story, and for a lot of people, it's a welcoming one.
And I guess going back to the point that Michael, you made earlier around cloud, for some small businesses, it would probably be really difficult for them to have cloud hosting in every jurisdiction. It would become quite costly for them to have services out of Western Europe, out of the UK and the US, but they might have an amazing innovative product that someone wants to use. So this at least does help us navigate some of those problems that would have come about had this not been permitted.
Right, exactly. Conscious of time, guys, we've got 5-10 minutes and we got a few questions that are submitted before we even started today. So if you don't mind, I'm going to just ask these questions ahead to you guys. So Michael, let's go with you first. So as a security professional, do you think it's becoming more difficult to protect data in the healthcare sector?
Oh, yes. It's becoming more difficult because we're having new things get developed. New ChatGPT is an example, what we just talked about here. But as these new things get developed, we figure it out. It takes us some time, but then we get the right guidance and start building controls around it. It's a lot of what we already have, just built to support this new thing. And so, yes, things are getting more difficult, but we're able to, keep up with it. So. Yeah.
Okay, and then that leads quite perfectly actually into the next question, which I'll direct at you, Sam. How do you keep up with the latest regulations or the latest updates with things that are happening in healthcare, the intersection of healthcare, security, privacy, sensitive data?
This is so challenging. I mean, I spend probably reading about it every single day, looking at cases that come out of different courts every single day or every week between the EU, the UK, and the US, learning from people. So often going to like seminars with lawyers that I know. And I'd say that most of this comes from talking to other data security, privacy professionals, people who are in the space. Actually learning from colleagues is probably the bulk of it, from people who might be CIOs, CTOs, CISOs. That's probably where a lot comes from. And speaking to the two of you, so it's hard to keep on top of it, but I definitely recommend, if people are in this space, to try and join a community, because often you'll find from a community of similar-minded people, you'll learn lots of things very quickly.
Yeah, and especially as you go, like you're saying, you're operating in different areas now and different countries, it gets exponentially harder as you start to do business across geographies, because it's not a one-size-fits-all in any way. All right, Michael, the next question we've got is looking for advice and feedback. Any advice on how to protect data with limited resources and getting buy-in from senior leadership when it comes to these matters?
Oh, yeah, with limited resources, I think that's something that a lot of organizations are dealing with now. And so prioritizing the most important things, going through looking at, there's all these things that you can do, but what's going to be the things that really help improve your security program, and presenting that information to your leadership team, expressing to them the importance of security. They have to be on board with it. If they're not, then there's no amount of things that you can do that's going to get the bar moving. So, whether you can tie a dollar amount to, like, if a breach happens, this is how much it'll cost us, and speak their language. That way they understand it. You have to figure it out and take that approach.
I could do some tips there, Michael. How do you put a dollar value on these things?
Oh, well, if you're talking about HIPAA, they actually have it documented on what the cost of a breach is per incident. And so you can look at that and, add it up. And then some of these other laws, standards, and regulations have dollar values for how much a breach costs. There's a lot of organizations out there that have done research and reports on that. And so you can go and find that information, create a report, and share that with your leadership team.
Always, when getting buy-in, putting a dollar value is helps a lot. Sam, same question for you. Any advice on how to protect data with limited resources?
Very, very similar. Two things. One, I like to use any tooling we can get, which makes it easier and more efficient, and advocating for tooling. So wherever we can automate or use tooling, it makes life easier, but it also means it keeps our costs down in general. But actually, similar to Michael, and there's three things I draw to people's attention. One are the fines that are levied and issued, and I see them across different courts in Europe. There were different data jurisdictions in Europe that issue fines to organizations. The second is damages, where not only have people suffered fines, but they've then had to pay out damages to those people whose data has been breached. And the third is where we see organizations fall down from reputational damage as a result of both of the earlier two things. And those things often sharpen the mind around getting resources for data privacy and security.
That's great. That's some great tips. And on that note, I think this is a good place to wrap up today's session. So thank you both for your time. It's been super productive. I'm actually excited now for the next one. I think definitely something around ChatGPT, gamification. I think we could have talked a long time there. But appreciate both your time, for everyone for joining today, and those watching it afterwards. But for now, we'll leave it here and hopefully look forward to the next one.
Awesome.
Thank you, Rich. Thank you, Michael. It's been a pleasure.
Thank you both.
Thank you.
Enjoyed it. See you later. Bye.
All right, see ya.